I'm going to show you a soft tissue tumor that arrived our consultation. Is a 65-year-old male with a prepatellar 6.5 centimeter mass, which was described as gelatinous and adipocytic in appearance in microscopic appearance. You can see here that the lesion is composed of lobular fat component, also ropey collagen, like you can see here, and somehow a myxoid component. Now, in next slide, we're going to have a closer look of it. So you see the mature adipocytic component that is lower in configuration. Also, the fibromyxoid environment or background, adding to that the spindle cell component that is going to be shown here. There's also some vascularity associated with it and certain pleomorphism or in the myxoid and spindle cell component. Besides that, there is also ropey collagen and plenty amount of mast cells, as you can see here. Actually, we were looking actively for floret cells. This is perhaps one floret cell, but I cannot tell with complete certainty. However, floret cells are seen in the pleomorphic variant of this type of lesion. By immunohistochemistry, this is CD34. You can see that the spindle cell component is fairly positive, clearly positive, which is one of the main characteristics of this type of tumor. K67 in a hotspot, like in this spindle cell area, is about 20 to 25%, but there's no mitotic activity that is of significance. Another part of the lesion is showing us that the location is fairly subcutaneous, and S100 is highlighting the mature adipocytic component. This tumor that I'm going to show you here again, or better, this slide, is a spindle cell lipoma or a spindle cell pleomorphic lipoma. Both are the same entity. This case is showing the typical characteristics and features of this lesion, that is 80% present in the subcutaneous region of posterior neck and back, but 20% can be in some other places. This was located at the prepatellar region and the limb. 90% of them occur in males, and among all the adipocytic tumors, the ratio is 1:60 compared with conventional lipomas. Typically, this tumor has a molecular feature in many of the cases, in the majority of cases, that is deletions in the long arm of chromosome 13, and also some deletions in chromosome 16, but mostly 13q deletions, which are related to the cluster breakpoint for the RB1 gene, and that confers a typical molecular characteristic of these tumors that are clustered in a family named the RB1 family or 13q deletion RB1 family of tumors that include this spindle cell lipoma, the pleomorphic lipoma. cellular angiofibroma, and myofibroblastoma. So this case was signed as a spindle cell lipoma.